The holidays are upon us, and that often means travel and large gatherings and an increased chance of getting sick, which is why we are talking to Dr. Tobias Pusch, an infectious disease specialist at Providence St. Vincent Medical Center. So let's start with, how is the cold flu COVID season looking so far this year?
So right now we're fortunate, it's relatively low. The incidence rate is relatively low. We had a summer high and came down from this, but it's expected to change quickly with the holiday season and the gatherings coming up.
And we are coming right up on Thanksgiving. Let's say you're headed to a gathering. What should you do to protect yourself?
Clearly vaccination, I know it's on everybody's mind, and there's been some vaccine fatigue, but it's truly scientifically the best way of preventing infection for yourself and not to pass it on to others.
Now let's talk travel, because I was just recently at the airport. Not a ton of people wearing masks. Should we mask if we're traveling?
It's true, and not a whole lot of people do. We should. Those are areas where a lot of people get together and exchange a lot of air quickly, and the rates of infection would be anticipated to be high in close contact, particularly over the holiday season. So yes, we should be masking, protecting us and others.
What symptoms should you be looking out for if you're about to travel? What should keep you home if you are experiencing symptoms?
That's a great question. So monitor yourself: fevers, chills, headache, cough, sort of muscle aches and joint pains, typical symptoms for flu or COVID. It's difficult to distinguish the different viruses, but any of those should ring the alarm bell and protect yourself. And if you're too sick, really don't travel.
How about testing?
There's a large number of tests that are available for COVID and for flu, and now there's also combination tests available for COVID and flu. As of last month, the FDA approved a test that can be done in 15 minutes and test for both most common viruses, flu and COVID.
Let's say you test positive for COVID. What are the current quarantine rules?
As long as you're symptomatic, you really don't want to expose anyone. You should be without fever or resolution of symptoms within at least 24 hours before you again travel publicly and expose others, and still mask yourself for about 5 days after the fevers have resolved.
For more information, visit providence.org.